This is the orientation of the heart in situ, and in this video we will be concentrating on the internal features of the heart. To orient ourselves, we have the right ventricle here, with this window cut out of it, and we can just see the left ventricle over here. If I turn the heart to the posterior aspect, we can see the dissected windows of the right atrium and the left atrium. Now I'll jump back to the anatomical position and we can have a look at the internal features of the right ventricle. As I zoom into this right ventricle, we immediately meet this anterior papillary muscle. This muscle receives innervation from the moderator band. The papillary muscle acts to pull these chordae tendineae tight to prevent the valve being flipped inside out during ventricular contraction. This septal band here forms the bridge between the ventricular septum and the moderator band. These structures are also present in the left ventricle. However, they are not as visible as they tend to run within the tissues rather than the chamber. So typically, images of the septal and the moderator band in textbooks imply it is only in the right ventricle, but this is not the case. We have viewed the chordae tendineae and the moderator band of the right ventricle, but let's have a look at what structure they act upon. If I turn this heart around and have a look through this window of the right atrium, we can see the three leaflets of the tricuspid valve. And whilst we are also in here, it's worth looking here at the wall of the atria, which is lined with pectinate muscle. The pectinate muscle is found within both atria, and they are named after their resemblance to the teeth of a comb. They are relatively thin and fat, and have likely evolved like this to provide strength of contraction without increasing the heart mass. We also have muscles lining the ventricles, and if I go back to the right ventricle, we can see here the irregular ridges of the muscle called the trabecular carne. This muscle is round and irregular, and it's slightly developed this way, opposed to the thin tooth-like appearance of the pectinate muscle, to prevent the suctioning of the muscles during contraction. The irregularly shaped muscles decrease the surface area of the muscle that's in contact with blood, and you have less suction. When we look through the dissected wall of the left atrium, we can see the bicuspid, or the mitral valve. But if we look on the intraatrial wall, in this specimen we have a patent foramen ovale. Under normal circumstances, this would have flipped closed when the fetus becomes a baby and takes its first breath. However, in this heart it hasn't. I have jumped screens to another heart photogrammetry so we can see how the intraatrial wall should look. As I zoom in here on the right atrium, we can see this thumbprint impression in place of the foramen ovale. This is now called a fossa ovale, fossa meaning impression. Going back to the first heart we looked at. Now this is not strictly an internal feature of the heart, but this model is particularly handy for seeing how the coronary arteries branch from the aorta. If we look at the aorta, this is the aortic valve. Now if I zoom in, we can just see two holes, one here and one here. These two holes are where blood is able to leave the heart. After ventricular contraction, as the heart refills, these leaflets close shut and blood is able to fall back down through the holes into the right and left coronary arteries, where it heads on its coronary circuit, perfusing the heart tissue with its high demand of O2-rich blood. I hope this video has been useful for seeing the structures of the heart in situ. The links to the photogrammetry are below, so use these for exploration of the internal and external features of the heart.